Hello, everybody, and welcome to Unsolicited Conversations with J and B.
J and B.
So we're two people that would like to bring to you unsolicited conversations about everyday topic with everyday people, folks that work in the trenches every day. And today we're going to talk about female hormones, which Jodi has to deal with every day as a nurse practitioner. So Jodi, can you kind of talk about what we're going to discuss?
Yeah, I mean, Brad, I don't only talk about female hormones at work, but I am female.
You
and
are the power of
yeah,
she?
The power of she, which we're talking about this superior species today.
I need a power of he.
And just why hormones are so important and how do we navigate hormones in today's healthcare system and just overall in life. I think it's been really eye-opening to me over the this last week. Because again, I had another week, Brad, where
Jodi's rant week.
Jodi's rant week. Just of understanding hormones from a teenager perspective. So I have a daughter who's 13.
Oh my.
And it's been a week. And I remember, I don't really remember going through the transition or starting menarche when I was that age. It was very different when I was growing up. My mom was not did not openly communicate over, I guess, normal physiology of things that we go through. And we learned it in school in our health class. And that was about it. And plus I had two older sisters, but I don't remember talking to them about it either. And so
you never learned about menopause, for example?
I definitely didn't learn about menopause, and what I learned about menopause was far different than what I feel like I experienced myself, not necessarily menopause, but also what I've seen throughout my 20 years of practice. So I've been in cardiology for a number of years. And when I first started practicing in cardiology, it was when the Women's Health Initiative was first released. And in the cardiology practice, we took a lot of females off of hormones right away.
Yeah.
And I was still very young and new at that time. So I think I was, you follow the data.
Right. And that was because of the cardiovascular risk, right?
Cardiovascular risk, breast cancer risk, ovarian, all the different cancer risks. And what are the leading causes in the US today? Cardiovascular disease or heart disease,
Sure.
cancer. Metabolic disease. And unfortunately, our healthcare system is another leading cause of death or morbidity, mortality. But that's a topic for another day. But as I've grown in the healthcare system and I've grown as a nurse practitioner, I've experienced a lot, not only with my patients, and myself, but also with my daughter. And so I kind of transitioned into this phase of learning more about this because of my daughter's journey with cancer when she was diagnosed in 2018. Granted, she was only 6 years old at that time, and now she is 13. And we did her follow-up. She's followed every year, but we met with the Hope Clinic, which is her lifelong clinic for the rest of her life, because she'll be followed for the rest of her life for the type of tumor and cancer that she had. And the chemotherapy that she received was unbeknownst to me, because I did ask the questions, but yet in the thick of it all, you go on and you're just in protective mode of like, my daughter needs to survive and we need to do what is indicated at that time for her stage of cancer. So they were going through her chemo treatment and saying, she is likely never to be fertile in her life. And where is she at from an endocrine standpoint, a hormone standpoint, because of the high dosages of chemotherapy that she had. So really it was just this summer that I'm like, I need to start focusing on this for her future and female hormones for her. But then I'm kind of in the thick of things too when it comes to perimenopause. So I'm like, I need to learn more about this. I need to better understand more than what I learned in school.
Oh, well, oh, absolutely. It's
Yeah,
pretty
so
limited. Yeah.
it was very limited. I mean, granted, I'm a family nurse practitioner, so we take care of individuals from birth to adulthood or death. And you learn little bits about everything.
So you wouldn't deal with my hormone issues?
I can,
Can
but we're not going to talk about male hormones today, Brad.
It's power of she.
It's not about you today because we're talking about us.
The power of she.
The power of she, yes.
So just a sidebar conversation, how is male and female hormones different?
I mean, male and female hormones are definitely different when it comes to how much we have, like testosterone.
Yep.
We all have testosterone. We all have estrogen as well. Progesterone, not as much, obviously, in males, but we all have no. No,
it's just estrogen, testosterone.
Estrogen, testosterone.
Right.
But why do we want to bring it up now? I think it's becoming more and more evident in the research of our aging society and our unhealthy society. And did we do a disservice to our population years ago when we started taking them off of hormones and then not understanding the risks associated to that? Because females are natural to us, or hormones are natural to us.
Right.
And so my philosophy with practice and just how I treat patients is if I can keep everything natural as possible that is physiologic to us, that's how we should go about treating our body from this day moving forward. It would be great if we could always start in our youth and then beyond, and hopefully we wouldn't see the sicker population. But I deal with mostly adults and kind of the years of, I guess, not unhealthy activities or lifestyle that they've experienced prior to going on a journey of health. So with that said, why are hormones so important to discuss now? Because we are seeing people live a little bit longer, but they're not living truly to their best ability. And hormones play a big part in that because our hormones, we peak, into early adulthood and then they start declining. So with that said, should we just let nature take its course, or should we always have natural physiology in our body? And that's what we strive to replace for the rest of our lives.
Well, so hormones, does it help with, obviously, with bone density and strength?
Absolutely.
So if you're in a nursing home or whatever the case may be, you may obviously struggle falling down, breaking hips and all that. So is it possibly true that in a nursing home alone, if these people had been treated with hormone replacement therapy or hormones earlier on, that they be in better condition and live longer?
I would say yes.
Yeah.
And I think that's where I'm coming from now is I've worked in nursing homes, I've worked in acute care hospital facilities, and I've worked in outpatient clinic settings for over 20 years. And so I've seen tons and tons and tons of patients that I now am kind of reflecting back on how they presented and what their diagnoses were. And I'm like, how can we now get back to a state of health and what should we have done? And I think part of it is we've already done one topic on sleep, focusing on sleep, focusing on what we eat every day, nutrition wise, and then focusing on how we move. And what impacts all three of those pillars of health is how our natural physiology works. And that comes down to hormones. And we have multitude of symptoms that are associated to hormones as they decline or as they're kind of going up and down. Cyclical, every female per month goes through their hormonal cycle. And
when they
you have
when they get the little visit every month.
Exactly, Brad. Yes. And again, why the female species is much more powerful and strong, stronger than men.
Here we go.
Is because of what we go through. I mean, we give birth. Would a man ever be able to give birth?
No, I don't want to do that. And I couldn't do that. And I don't want to do that, Jodi. God bless you women.
And just you have like 2 weeks out of the month of maybe being like yourself. And then you have ovulation, and then you have your cycle. And that is all dependent upon hormones and how they function, and the increase in estrogen, the increase in testosterone or progesterone, and then how they decline. And your moods are associated to your hormones. Your bone stability are associated to your hormones. Your, again, just your behaviors, how you respond, anxiety, heart palpitations, your cardiovascular system. Your body is dependent upon not only your ovarian and female hormones, but also all hormones, our thyroid hormones, the ghrelin hormone that makes us hungry, or leptin that kind of gives us satiety. So
Right.
with that said, hormones are a part of our life every day. And if we can naturally replace them, I think that we would see a much healthier society. And how do we replace them naturally during our good quality years before we start to see the natural decrease in them is through sleep and movement and good nutrition.
Yeah.
Yes. So today we're going to just really focus on introducing hormones and why they're so important, and maybe even do a few interviews with people at the local gym who want to share their, life experience with hormones. I'm sure they've had parents who are moms who have gone through menopause and what that experience was, or do they even know what her experience was? Because we grew up in a generation, or I feel like I grew up in a generation that we didn't talk about it. Like that's just not something that you bring up in everyday conversation.
Mm-hmm.
And I think you and I, Brad, this is one reason why we like this podcast, because it is an everyday conversation and things that should be talked about.
Sure.
And they're not always openly communicated.
I mean, let's be honest, Jodi. We even get to talk about morning wood and why testosterone
Exactly.
is good for men.
Yeah.
And what it does for us too. I mean, if I were she, I get it, Jodi.
I'm like,
but there is something.
And during that surge, that ovulation surge, maybe they like that.
Could be true. Anyway, hope you enjoy it today. We're going to interview a few gals to find out what they know about female hormones. See how this goes. It'll be interesting. Thank you all.
Well, Brad, we're at the gym today, and we decided that we were going to interview some special friends and just ask, what is your understanding of perimenopause, menopause, and have you gone to the doctor lately and been given sound advice? Were you ever, did you have the conversation with your mom growing up about what to expect as we age into this phase of our life?
Sure. So first thing, no, I was never talked to about it.
Okay.
From mom. I just noticed growing up, she would change.
Yeah.
And so it was kind of like, oh, mom's in a bad mood. Let's step off. No big deal. And then as I got older and I started going through the changes, I was like, oh, I'm in a bad mood. And what do I do? Yeah. Coming upon my early 40s, just still trying to figure it out. And then all of a sudden it was like overnight it hit. And I immediately was like, I'm in perimenopause. We've got to do some things, because I was really enjoying my lifestyle. Yeah. Attitude was great, working out. And then the hormones just seemed to clash and I was tired, wasn't able to sleep.
Yep.
All of the little mishaps that come with it that you hear about.
Yeah.
So,
well, what we hear about, like, what kind of symptoms did you have specifically? Because I see patients every day in sleep medicine and in the cardiovascular world, had a lot of patients that came in with palpitations or I don't feel well. And once you ruled out anything cardiovascular, it's like, oh, you're depressed. So do you feel like, what kind of symptoms do you have? And then let's go through the multitude of symptoms people can experience.
Yes. My first symptom where it was really a clue was the night sweats.
Okay.
I could not figure, I knew what was happening, but I, again, was in some sort of denial because I'm like, oh, I'm too young.
Yeah.
I work out. I eat okay. my diet's almost where it needs to be. And then I wasn't sleeping. I was waking up, drenched, as they all say.
Mhm.
That's not fun. And then throughout probably that month, I just remember I was so tired.
Yep.
Always tired. I couldn't take enough pills to wake me up. Ginseng became my best friend. All of these artificial energy things. Nothing was helping. So the sleepless nights is what really started to bother me.
Yeah.
And then I did go see, I got a lot of input on OBGYNs because the first thing I said to my regular doctor was, I do not want to be put on antidepressants. That's not what's happening.
Yeah.
And that was just communication from others that I've heard. Oh, don't let them put you on antidepressants.
Yep.
And I said, okay, well, yeah, that makes sense. I'm not depressed. I know these things. So I went through about 2 OBGYNs and then finally found a really good one who she was able to finish my sentences on what was happening to me at my certain age and through my body. And that was just, it opened up a world of knowledge for me, basically, because I did find somebody who was not quick to put me on antidepressants.
Yeah, absolutely. I think that that's one thing in sleep medicine that I hear every day is, well, I'm fatigued. I'm so tired, Jodi. I can't stay awake during the day. I have to take a nap during the day. I'm awakening in the middle of the night with feeling my heart racing.
Yes.
I awaken with night sweats or a hot flash, or my mind is spinning and I can't get out of this kind of wheel or circle, kind of
Yes.
circle of death of like,
Yes.
I'm worried about work. I'm worried about my kids. I got to go check on my kids. So you just start spinning. So that's what we call sleep fragmentation. And then sleep fragmentation leads to this downstream effect of everything else.
Right.
And so I'm hearing this day in and day out, and I'm like, wow, we've missed, I think, a few things, because I have most patients come in. These are the symptoms that they're presenting with. And then I look at their medication list and they're on antidepressants.
Mm-hmm.
And I'm like, did you find a provider that would listen and
Right.
really take notes and understand like every symptom that you're expressing is related to potentially a phase of life that you're in, which is
Yes.
perimenopause, which can happen
Right.
in the literature. We used to think you have menopause and it's 1 year following the cessation of your last period,
Mhm.
right? So that's what we learned in school. And the only thing else that I learned in school was I can have a hot flash. And I'm like, oh, okay.
Yes.
So that's
Mhm.
all I really learned. And now we're learning more and more that perimenopause can happen at 10 years prior to that last
Mhm.
cycle. So, you can see 37-year-olds and 38-year-olds. And when we start, I remember seeing them in the cardiovascular practice, and people will come in with palpitations and we're like, oh, you're fine. Maybe your electrolytes are off, or you worked out too hard, or you didn't sleep well that night, and just kind of blew it off. I remember I was that provider that would be like, oh, I got another female in with palpitations. And now I'm living it, and I am like, I need to kick myself. And I kick myself in the ass and
Right.
say, why didn't I pay attention more?
Mhm.
And so I'm learning along the way, and I'm a much better provider having had those experiences. But also now, I think, Brad, our goal is to really communicate with people and understand, because we are all unique individuals and we experience things much different.
Yes.
And so, getting to know people at the gym and understanding what they go through only helps me to be a better provider and also be a better patient and be a better mother to my daughter, to openly communicate with her about what she's going to experience in life and how important it is to those feelings that you're feeling or those symptoms that you're having are real. So Alyssa, do you think that in your experience living here, that you found a provider that's well versed in this and that they listen to you and you've been able to advocate for yourself and then make that shared decision together?
So I am very fortunate to find a provider in the Springs area, and I've actually recommended her to others. Unfortunately, she is so booked up
Yeah.
and it's one of those situations where you found somebody you want to everybody to go to because she does understand.
Yeah.
And for me, finding her, having a conversation with her, a real conversation, to say, this is what's happening. I'm only, 40 years old.
Mm-hmm.
And it was like, oh, yes. She validated that what I was feeling was correct.
Was real.
Yes.
Yeah.
And she literally, it was at that moment, I just remember like being,
Taking a breath and you're like,
yes.
Finally somebody understands me.
Yes, exactly. And as we began this journey of what was happening to my body, we went through different medications, and she put me on progesterone, a small dose, because of the night sweats.
Yep.
And it was automatic. It was just a huge weight off my shoulders because I was sleeping. I had a better attitude. I was
Mhm.
able to conquer more responsibilities without the head spinning.
Yeah. Yeah.
And just to your point, to find somebody who actually listens to you and validates what you're feeling is amazing.
Yeah.
And I do agree. I've got a daughter who's also in her early 20s, and I'm like, oh, honey, sit down, let's talk.
Yeah. And to also know that, like, if people who are younger in their 20s experience certain symptoms, to also
Mhm.
talk about it, because
Yes.
there is such a thing as premature ovarian failure. And you kind of you can go through an earlier menopause in life. And so just know that if you are very consistent in your life, like we are pretty consistent people that go to the gym every
Sure.
day, we work every day, we try to
Yes.
eat healthy and eat consistently. When something is off, your body is telling you that. And so those symptoms are real and you should pay attention to them.
Agree.
So I think
Mhm.
that's another
Yes.
thing that I think being open about that, because some people want to just hide those things and they're like,
Mhm.
I don't need to talk to anybody about that. Is that real? Is it not real? And being very knowing your body. And I think the only
Yes.
way to really know your body consistently and what it can do and how it can perform is always going through the pillars of health.
Yes.
Brad and I have talked about this quite a bit on our podcast. Is sleep, as we've done
Mhm.
one podcast on sleep and the importance of it, which we will always kind of go back to because
Right.
it's truly a pillar. It was one of the first symptoms that you had that you
Mhm.
started
Yep.
noticing that
Yep.
got you into a provider. And so that's one thing. And then fitness. And why do we fitness? Do we fitness every day because we want that certain physique? Or are we doing it for our longevity and our health? To me, I know why I do it, but
Yes.
why do you fitness every day?
I love this question because I have been doing a lot for my body for years in form of different exercises. And it was about the physique,
Mhm.
20s, you want
Oh,
that
yeah.
two-piece, you want to go to the beach. And then as you get into your routine and it just becomes routine and consistency,
Mhm.
you start to see how much how it adds value to your life.
Absolutely.
And so as I'm getting older and I'm still being able to work out that full 45, 60 minutes,
Yeah.
that is a huge win for me because now the physique is coming along, but so is more of the longevity. And I
Yeah.
feel better and I have more energy. The sleep is so much better with all of that.
Absolutely. It helps sleep. I mean, it's the number one. I deal with a lot of insomnia, which
Mhm.
a lot of hormones are driven,
Yes.
drive the insomnia,
Yes.
but that's another topic for another day. But the one treatment, and I think Peter Attia just had this on one of his like updates for a research article. There was a research study recently about exercising every day. Not only is it improving your quality of life,
Right.
but it also treats insomnia, and that's one of the another symptom of hormones as they start to decline.
Mhm.
And so, I mean, there's all these symptoms that go back to
Right.
hormones, natural physiology, and I think why
Yes.
it's important to replace them as we age into that phase where they start to decline. but also keeping track of them when we're younger too, and maintaining them. And how do you maintain healthy hormones in our youth is through sleep, through exercise. And the other importance of exercise is the bone stability for us as females, because we have no control over when our hormones do start to decline naturally. And with that, with estrogen declining, we have bone instability. And so holding a barbell, my shirt on that is on underneath this is my ideal body weight is a barbell in my hand. And that's what I try to preach to people every day too, is put some weight in your hands, keep your bones strong, and then that will also enhance your hormones too. So, Alyssa, thank you so much. Do you have any questions or anything else that you want to share with our audience?
I don't. Thank you. It's amazing to be a part of this and to get older and know that certain actions are normal. Certain feelings are normal.
Yes. And I think that's the most important thing, is that when you are feeling down or anxious, it can be associated to hormones, and it's not just you are depressed and you need an antidepressant. A pill is not always the answer.
Well,
all right, Brad.
Jodi, that was awesome.
That was so fun.
Melissa did a great job, didn't she?
She did amazing.
If I need another partner at some point,
I know. I'm going to
listen. Well, that's true. But also, it was a great job. You both did. It was phenomenal. I learned something. Looking forward to the next episodes too.
Yeah. And please like and subscribe our channel. And moving forward, we will have a series of topics on female hormones. Moving forward, we're going to have our next one on physiology, natural physiology of hormones from birth to adulthood, menopause specifically. And then we will follow that with what questions and how do you advocate for yourself at your provider appointment. If you like and subscribe, or you go to our channel, we will have resources for you there with books for you to just empower yourself and add knowledge, for you to also advocate for yourself and go when you're going to your provider, and other resources in our local community of who you can go to for access.
Great job.
All right. Thanks,
Jodi.